Today I'm going to be performing the Selective Functional Movement Assessment. For this, we're going to be testing to see if the patient is functional or dysfunctional in different movements that we're going to ask them to perform. We're also going to ask if they have pain during any of the movements. A muscle stretching pain does not count as regular pain for this. So first we're going to do active cervical flexion. So for this, we're going to ask the patient to bring their chin to their chest. Okay. And then since he is able to touch his sternum, we would label him functional. Did you have pain with that?
No.
Then it'd be functional, non-painful. Next, we are going to perform active cervical extension. So for this, we're going to have you bend your head back and look straight up at the ceiling. Bend as far back as you can. And for this, we're looking to see if he's able to get parallel or within 10 degrees of parallel. You can come back up. Did you have pain with that?
No.
So then he would be functional, non-painful because he was within that 10-degree range. Next, we're going to do cervical rotation. And so for this one, I'm going to ask you to turn your head to the side and then bring your chin down to your collarbone. Okay. And so since he is able to bring his chin to mid-clavicle, he would be functional on the right side. Did you have any pain with that?
No.
And he'd be functional, non-painful. Can I have you do the same thing to your left side? So he is, again, able to get to mid-clavicle. Did you have pain with that one?
No.
Then he would be functional, non-painful. Next, we're going to do upper extremity pattern number 1, which is medial rotation and extension. And so for this one, I'm going to ask you to bring your arm behind your back and try to touch your shoulder blade. Okay. And so for this one, we're looking to see if he's able to pass his inferior spine of his scapula. And so since his fingers are above it, you can relax. He would be labeled functional. Did that cause any pain?
No.
So then on the right side, he would be functional, non-painful. Can I have you do the same thing on the left side? And once again, he is able to pass the inferior angle. Did you have pain with that?
No.
So again, he'd be functional, non-painful. Next, I'm going to ask him to bring his arm up and over his head and touch his scapula. And so for this, don't raise the shoulder up. Yep, just leave it down. And so this is upper extremity pattern number 2, lateral rotation and flexion. And so for this, make sure to relax the shoulder. You want to see if they are over the spine of their scapula, which his fingers are not. You can relax. Did that cause you any pain?
No.
Then he would be dysfunctional, non-painful. Can I have you do the same thing with your other arm? Yep, relax the shoulder. So for this one, he is able to pass the spine of his scapula. So you can relax. Did that cause any pain?
No.
Okay, then he would be functional, non-painful on the left side. Next, we're going to do the multi-segmental flexion. And so for this one, we're going to ask that they stand shoulder width apart. Yep. And then we're just going to ask them to bend over and touch their toes. So for this, you're looking to see if they're able to touch their toes. Also looking at their spine to make sure you see a uniform curvature. Also looking at his sacral angle to make sure it is less than 70 degrees. And finally, you want to make sure that his thoracic lumbar junction is over his midfoot, which his is not. And then can I have you stand back up? And finally, you want to make sure that they're able to stand back up. So overall, I would label him dysfunctional for this because he had multiple abnormalities with this. And did you have any pain with that?
No.
Then it would be dysfunctional, non-painful. And then we're going to do multi-segmental extension. So can I have you bring your arms up and then bend your body backwards? Yep. And so with this one, we're making sure that there's no loss of shoulder flexion. also seeing if the ASIS is over the toes, which his isn't quite over it. Then also looking to see if the spine of the scapula is over his heels, so you can relax. And his was, but I would label him dysfunctional for this. Did you have any pain with that?
No.
Then it'd be dysfunctional, non-painful. Next, we're going to be doing multi-segmental rotation. And for this one, you're just going to ask that they stand with their feet shoulder width apart and then rotate their body to the side as far as they can. Yep. And so for this, you're making sure that there's no knee flexion. Also looking to see if his pelvis was able to rotate 50 degrees. And then looking at his trunk and arm to see if that was able to rotate another 50 degrees. You can relax. And so since he was able to do that, we're going to label him functional. Did you have any pain with that one?
No.
Okay, then it'll be functional, non-painful for the right side. And next we're going to come over and can you do the same thing on this side? So now again, no knee flexion, pelvis is able to rotate 50 degrees, trunk and arm is able to rotate another 50 degrees. Okay, you can relax. Does that cause any pain?
No.
So again, then on the left side, it would be functional, non-painful. Next, we're going to do the single leg stance. For this one, we're going to test your left side first. So can I have you bring your leg up? And yep, so they're just going to keep it at a 90-degree angle. They're going to hold this for 10 seconds. You want to make sure that they're able to keep their leg up. You make sure you don't see it drop. Okay, now we're going to perform the same thing with their eyes closed. And I'm going to stand here to make sure they don't fall. And again, holding it for 10 seconds. And relax. And so his leg dropped significantly with that one. He was able to bring it up a little at the end, but I'm going to label him dysfunctional for that. Did you have pain?
No.
Okay, then it would be dysfunctional, non-painful for the left side. And then we're going to do the same thing on the right side. So bring your leg up again. Yep, and then hold that for 10 seconds. Okay, now eyes closed. And again, we're going to hold it for 10 seconds. And relax. So he was able to keep his leg up at 90 degrees of hip flexion for the duration of the test. Did you have any pain with that? No. So then he would be labeled as functional, non-painful. Finally, we're going to do the overhead deep squat. So for this one, you're going to have them stand, their feet shoulder width apart, and then you're going to have them bring their arms up, and then you're going to ask them to go into a deep squat. Yep. And so from the side, we're looking to make sure that he has his spine in neutral. We're also looking to make sure that he doesn't lose any shoulder flexion, make sure his arms are straight, and also looking to make sure his toes don't come off the ground, and finally looking to see if he's able to get past parallel. You can stand back up. Did you have any pain with that?
No.
He wasn't able to get to parallel, so we're going to label him dysfunctional, non-painful. And that is the completion of the test. Today I'm going to be performing the selective functional movement assessment. For this, we are going to determine if the patient is able to perform different motions, and we're going to rate them as functional or dysfunctional. We're also going to ask if they have any pain and note that as well. For this, if you feel any muscle stretching during the test, that does not count as pain. So first we're going to do active cervical flexion. And so for this, I'm going to ask them to bring their chin to their chest and she's not able to get her chin to her sternum. You can lift your head back up. Did that cause any pain?
No.
Then they would be dysfunctional, non-painful. Next, we're going to do active cervical extension. So for this, we're just going to ask them to bring their head backwards. And for this, we're looking to see if they can get parallel or within 10 degrees of parallel, which she is able to. So you can bring your head back up. Did that cause any pain?
No.
Then that would be functional, non-painful. Next, we're going to do cervical rotation, lateral bend. And so for this one, I'm going to have you turn your head to the side and then touch your chin to your clavicle. And she is not able to get her chin to mid-clavicle, so we would label her as dysfunctional. Did that cause any pain? It's going to be dysfunctional, non-painful for the left side. And then can you do the same thing for your right side? And again, she's not able to get her chin to her clavicle. And did that cause any pain?
No.
Then again, it would be dysfunctional, non-painful. For the next one, we're going to do upper extremity pattern number 1, medial rotation and extension. And so for this one, I'm going to have you bring your arm behind your back and try to touch the opposite scapula. And so for this one, we're looking to see if she's able to pass the inferior angle, but she is just on the very outside of the angle, so I'm going to label this as dysfunctional. And did you have any pain with that?
No.
It would be dysfunctional, non-painful for the left side. And then can you do the same thing with your right arm? And then again, she's not able to pass that inferior angle. You can relax. Did you have pain with that?
No.
Then again, it's going to be dysfunctional, non-painful. And then for the next one, upper extremity pattern number 2, lateral rotation and flexion, I'm going to ask you to bring your arm behind your head and touch the opposite scapula. And so for this one, she is not able to pass the spine of the opposing scapula. You can relax. Did that cause any pain?
No.
Then we're going to label her dysfunctional, non-painful for the right side. And can you do that with the left arm? And again, she's not able to pass the spine of her scapula. You can relax. Did you have any pain with that?
No.
Then again, it's going to be dysfunctional, non-painful. Next, we're going to do multi-segmental flexion. And so for this one, I'm just going to have you stand shoulder width apart. Yep, and then I'm just going to have you bend over and try to touch your toes. And so for this, we're looking to see if they are able to touch their toes, looking for a uniform curvature in their spine. Also looking to see if their thoracic lumbar junction is over the midfoot, which hers is not quite there. We're also looking at the sacral angle to make sure it's less than 70 degrees. And then can you stand back up? And then that's the final portion if they're able to stand up. And so I'm going to label her as dysfunctional for this. Did you have any pain with that?
No.
Then it's going to be dysfunctional, non-painful. For the next one, I'm going to have you raise your arms up and then bend back as far as you can. Okay? And so for this one, we're looking to see if the ASIS is able to pass the toes, which it's not quite there. And also looking to see if the spine of the scapula is able to pass the heels, which it is. And then also looking to see if the arms are able to maintain the degree of flexion. So you can relax. And so for this, I'm going to label her as dysfunctional. Did that cause any pain?
No.
Okay, then it'll be dysfunctional, non-painful. And for the next one, we're going to do multi-segmental rotation. So for this one, again, standing shoulder width apart, I'm just going to ask you to turn your body to the side as far as you can. Okay? And so for this, we're making sure that the knees stay extended, there's no flexion, and we're also looking to see if the pelvis is able to rotate 50 degrees, and then the trunk and the arm are able to rotate another 50 degrees. I don't think that her trunk is able to rotate that additional 50, so I'm going to label her as dysfunctional for this, and then we can do a breakout test to make sure that, to see what's going on there. And so you can relax. And did you have any pain with that?
No.
So then for the right side, it'll be dysfunctional, non-painful. And can we do the same thing on the left side? Okay. And again, looking at the same stuff, I again don't think that her trunk is able to rotate the additional 50 degrees. You can relax. Did you have pain with that?
No.
So then that one's going to be dysfunctional, non-painful. Next, we're going to do the single leg stance. And so for this one, we're going to start on your left side. So you're going to bring your left leg up, yep, just like that. And we're going to hold this for 10 seconds. We're going to make sure that they don't lose any hip flexion. Want to make sure that they maintain this position. All right, and then we're going to do this with their eyes closed. And I'm here to catch you if you feel like you're going to fall. Yep, just bring your leg back up. And again, we're going to do this for 10 seconds. You're okay. Okay, you can relax. And so since she was not able to keep her leg up and she was losing her balance, we're going to label her dysfunctional for that. Did you have any pain with that? Then for the left side, it's going to be dysfunctional, non-painful. Then we're going to come over and do the same thing on the right side. So lift your leg up, yep, and just hold that for 10 seconds. All right, and now shut your eyes. And again, I'm here to catch you. You're going to bring it back up. Okay, you can relax. And so since she was not able to keep her leg at 90 degrees of hip flexion, we're going to label her as dysfunctional. Did that cause any pain?
No.
It'll be dysfunctional, non-painful for the right side. Then finally, we're going to do the overhead deep squat. It's going to have you stand shoulder width apart, bring your arms up, and go into a deep squat. Okay, you can come back up. And so for this, we are looking at their spine to make sure they are in a neutral spine position. Also looking to see if their hips pass parallel, which hers did not. We're also looking to make sure she doesn't lose any shoulder flexion, that her arms stay parallel with her head. And so did you have any pain with that one?
No.
Okay, then we're going to label that one as dysfunctional, non-painful. And that is the completion of the test.